Hello, and today we are going to be talking about what we call special populations in regards to massage therapy. Special populations being people or individuals that have certain limitations and might require certain considerations in regards to receiving massage. So with that, let's go ahead and define what exactly a special population is. Special populations are groups of individuals who, due to a variety of factors or are disadvantaged, vulnerable, and or at risk of harm. These factors can include physical or cognitive limitations, a life stage, or unique life circumstances that restrict an individual's rights and privileges. So it could be a wide range of possibilities here, and we'll look at a few very common ones that you might encounter within your massage practice throughout this little brief lecture. So let's go ahead and start looking at them. So first up, one category of one massage style, and then two special populations, people who might have specific considerations, which any and every client that is going to come to us is going to have special considerations, some more so than others. But prenatal massage is, as you might assume, the massage that we provide to pregnant clients. So we do have some considerations and concerns in regards to this, and I do have a video demonstrating techniques for the prenatal routine, but we're going to talk about right now just some of the general concepts and cautions and considerations for prenatal massage. So first off, with a pregnancy, you have what's called 3 trimesters. So, or 3 sections, 3 segments of the stage cycle of gestation, which is, developing a child within the womb. And so up until birth, we have these different stages. And then each stage, we have some considerations in regards to the health and well-being of our client. So these stages come in 1, 2, and 3 trimesters. The first trimester is probably the most cautious one we want to be worried of, with an asterisk there, and I'll kind of explain why that most massage therapists try to avoid first trimester pregnancies. But as we can see, a list of a few complications and things to consider is that within the first trimester, it is quite possible for the female to have a miscarriage. It's a very common thing, and I do believe that roughly about 25%, I think the statistical average is. So nearly a 1 in 4 chance that a woman will have a miscarriage within that first trimester. And so this is the big thing about why massage therapists try to avoid first trimester pregnancy. And it's, of course, massage, and depending on how you massage someone, could be problematic. And if you're extremely vigorous and massaging without any concern, maybe you could potentially lead to birth complications. But the biggest thing is that because miscarriage is so common, that massage therapists try to avoid this trimester because of just liability, right? That if a woman got a massage during the first trimester and then several days or maybe even a week later had a miscarriage, they blame the massage or something. And the massage most likely had nothing to do with that. It's just people get a little wild, a little crazy with their lawsuits there. So for that, plus just the instability of the first trimester in itself, is that being that the body's changing so rapidly and drastically, we do want to make sure that everything's okay and cleared by their obstetrician, their doctor, whoever, to actually receive the massage. So that's why most massage therapists will generally avoid first trimester, but not all of them do. So like we said, first trimester miscarriage is one of our leading issues with that. Deep vein thrombosis. Now, of course, this could, develop throughout all 3 stages here, but deep vein thrombosis, which you might have seen already in this program, is to develop a blood clot within the deeper veins of the body. And so within pregnancy, the clotting mechanisms of the body are increased, which gives you a higher susceptibility of developing a thrombus. Morning sickness. Morning sickness can actually go even into the second trimester, and morning sickness is more than just in the morning. It can be throughout the day. And so morning sickness is just obviously that, random, nausea and vomiting that they might encounter. So do consider that if you do work with pregnant clients, especially within the first and second trimester, that they might have an episode of vomiting. And so make sure, you got that wastebasket nearby. Breast changes. So this would matter only if we were going to place our client face down on the table. So yes, throughout the stages of pregnancy, the breasts and lots of other things in the body are going to be changing, the breast included, and so they'll start to enlarge as they start to develop milk. They will also be tender, so laying face down could be a problem. But we typically don't place our female clients, our female pregnant clients, face down as soon as we hear that they're pregnant, for obvious reasons. So now, of course, within the first trimester, there won't be much of a baby bump or anything, but it's just common practice to not have them face down. Typically, with prenatal massage, we're either going to have them in the semi-reclined position or sideline position, and we'll talk about that in a moment. So moving into the second trimester, we have a few things going on. Now that the baby is starting to develop more, the client is developing a bit more of what we call baby bump. We do have some things to consider. One is supine hypotensive syndrome. So supine hypotensive syndrome is a condition where if a woman is laying on her back, supine, and the baby shifts to the right side of the spine, then it can compress some major blood vessels, namely the inferior vena cava or even potentially the aorta, which is going to cause a drastic drop in blood pressure, especially if the inferior vena cava is compressed. It's going to stop a lot of blood flow going back to the heart. So hypotensive, right, drop in blood pressure. So in this case, this is the reason why a lot of times when you hear prenatal massage, it's always lay the client on their left side, so that when they're laying on the left side, the fetus will shift to the right, or shift to the left and away from the right side, to thus minimize the potential of this condition. Now, personally, I think that, and there's a lot of therapists out there who will only do left side lying, and I don't think that's that big of an issue to lay them on the right side. So, and I've had a lot of pregnant clients complain that their previous therapist had only put them on one side. And like, sure, you could probably still get most of the work done on just one side, but there really isn't going to be an issue with turning them so they can lay on their right side, because the fetus will shift forward too and away from the spine. And then if you have them in the semi-reclined position, then just, you can prop up their right hip to shift their body slightly to the left. So that way you can just try to avoid that condition as much as possible. Now, typically my go-to part of the intake with a prenatal client is to ask them, like, well, how do you normally sleep at night? And then obviously they know what they're doing, and they know their limitations. They know what makes them uncomfortable and all this, that, and the other. They probably were given suggestions by their doctors. So, typically I'll take that into consideration as well. Preeclampsia is a condition where we have what's called pregnancy-induced hypertension. And so this is where the kind of the opposite, where we'll actually have high blood pressure, some markations of protein in the urine, swelling throughout the entire body. So that's usually what we'll detect and give us an idea of or signs of this condition, is that there's swelling all over parts of their body that there shouldn't be swelling. Now, of course, it's normal for them to have swelling in, say, the lower ankles, like the ankles, legs, lower legs, especially, more towards the third trimester. But if you do see signs like in the arms or anything around the face, the neck, anything like that, that could be cause concern. But typically, pregnant clients are, regularly going to see their doctor, so they should probably have caught that before you did. Gestational diabetes is where, well, you would just develop diabetes because of the pregnancy. And with that in mind, now if they did develop preeclampsia or gestational diabetes, now it makes that client a high-risk pregnancy, and we'll talk about that in the next slide or two. But outside of that, our other considerations for diabetes still are relevant, which is to be mindful of the circulatory styles of massage, be mindful of potential peripheral neuropathy and their lack of sensation because of that. So, those basic things there. Moving into the third trimester, we see a longer list of things to consider. Some of these aren't necessarily bad per se. It's just, be mindful of. And I'll also say too, with the second and third trimester, we're pretty much into the smooth sailing portion. So like, especially towards the third trimester and the end of the third trimester, there's very few instances of things to go wrong per se. Doesn't mean impossible, but it's getting to be a little bit more locked in there. So we have relaxin. I'll talk about that in a second here. Heartburn, of course, lower back pain, pain in the feet, pain in the legs, pain in the neck and shoulders, edema in the legs, as we just previously mentioned. So in this case, with the child developing even more and the flow of lymph fluid and blood and all that is going to be restricted even more. So we're going to have more fluid retention in the legs. Varicose veins, again, same thing. Circulation is going to be poor, so the blood vessels can dilate. Plus the pressure, the weight, everything can cause varicosities in the lower legs. Frequent urination, because that child is literally just sitting on top of the bladder, so they might not even have to pee. They just might think they have to pee because of their bladder being crushed. And then, of course, stretch marks is also a possibility as the skin rapidly stretches and doesn't have the time to accommodate for the stretching. We get those stretch marks. So let's go back to, well, I'll just knock out the heartburn real quick. But of course, the child is also pushing up on the stomach, which then can, cause the regurgitation, plus the eating, the amount of eating that they'll be doing could also contribute to that. So relaxin. Well, when the woman gets closer to the due date, the body starts to produce this hormone, relaxin, and the relaxin's purpose is to loosen up the ligamentous and other various structures of the pelvic complex, and so that it'll allow the pelvis to widen and expand for the child to go through the birth canal. So, which, keep in mind, and I usually give this terrible example of, well, this is where the baby has to come out of, and it's not a very big hole, not a very big space for that 8-pound plus or minus child there. So we're going to loosen up the structures in the pelvis so that the pelvis can kind of expand, and it almost like the parts of and plates of the pelvis almost even separate for the child to come out. So with that in mind, we want to be extremely careful and, honestly, in my opinion, just not do any traction or deep stretching of the hip complex for the sake of not potentially tearing or injuring anything that's already unstable because of its preparation for birth. So with the back pain, lower back pain, like obviously, the child is literally pulling their back forward. It's literally pulling their whole body forward. Pain in the legs, pain in the feet because now you're carrying like an extra 50 pounds on yourself. Pain in the upper back, neck, and shoulders because of our previously mentioned thing, the breast enlargement adds just more weight to the front of the body, which then, leads to upper back pain, neck and shoulder pain, all that good stuff. So, our prenatal clients can definitely benefit from massage in all of those areas, and then especially within the third trimester, be very mindful of the movement of the hips. Other cautions and concerns is if, while we say we want to be gentle and careful with a pregnant client, well, we've also have had babies since the dawn of our existence, and that existence was usually pretty rough. So, pregnant women especially, a lot tougher than we can give them credit for. So Doesn't mean to just beat the crap out of them, but definitely do have some considerations, and you can definitely go in a little bit with some pressure to make sure that you're working out their problems and helping them to ease their pain, discomfort, and make them more relaxed. Other considerations too is with vigorous movement of the hips and pelvis, is it is possible to dislodge the placenta, and that's a very serious thing. Unlikely that you probably will, unless you're going crazy, but I thought I'd just throw that out there. So there's some of our considerations, complications, concerns for pregnant massage, and that's pretty much like a whole prenatal course there. So let's look at a few factors and considerations that indicate a high-risk pregnancy. So there's two types of pregnancies. We have low risk and high risk in regards to coming in to get a massage for us. Now, obviously, with low-risk pregnancies, right, we still want a doctor's clearance that their doctor's okay with them getting a massage. But high risk, is definitely a little bit more concerning because we really want to make sure that their doctor's okay with them getting massage. And it's just, again, mostly liability. But so like, let's say that your client came in and, they said they were low risk, but you saw some certain indications on their health intake form that would insinuate actual high risk. So there's a few things that potentially could be labeled as high risk pregnancy. So for one is the age of the expecting mother. Typically they say any age over 35 is turns into high risk. 35 is kind of the new 20 nowadays, right? Am I right? I wish, I hope. I'm 35. But, so age can definitely be a factor. Lifestyle choices such as smoking, drinking, all right, the use of other substances could be considered high risk. Of course, health issues with the mother already. So if the mother already had like high blood pressure, diabetes, other heart conditions, nervous system conditions, anything like that, we can consider that to be high risk because that will also be affected by the pregnancy. So then, of course, any pregnancy complications, which would be like we said, the preeclampsia, the gestational diabetes, if there's something wrong with the fetus itself, all of that could be potential. Multiple pregnancies, so women who have more than one child developing, so like twins or something, is definitely high risk, or a woman who's had numerous births within a short amount of time is also somewhat considered to be high risk as well. And then, of course, just as if they've been high risk in the past, if they have a history of being high risk, then they're most likely to be considered high risk in their further future pregnancies. So there's just a few little limiting factors there just to consider. Infant massage. So what exactly is infant massage, and what are some of the things we can consider? So infant massage involves the massage for, well, babies. So yes, massage, people always ask, like what age can you get a massage? And well, you technically, well, we just witnessed that you can massage someone even before they're born, right? Because if you think about how interconnected the body is, then massaging a pregnant woman technically inadvertently massages the baby inside the womb. And then, of course, as soon as that baby comes out, well, you can start giving it a little bit of massage. And then you can take that massage all the way up until the day of your death. So massage is a full life cycle style of treatment, in my opinion. Now, of course, with the infants here, we do have certain considerations. Now, we're not going to, drop elbows into a baby's back, but there is positive reinforcement with touch for infants, and especially for helping to develop the proprioception and locomotive systems within the child. Now, typically what we want to consider is that we as massage therapists aren't the ones that are going to most likely be working on the baby themselves. So that is typically for the mothers and fathers, and that helps to develop a bonding effect between them. Because, as massage therapists, we don't want to bond with some, random person's child. So, but we will demonstrate typically on a doll to teach the parents how to massage and work with the children. And typically that routine is just gentle rubbing and movements of the skin, and it's almost most likely like play, and especially like doing range of motion with the arms, doing range of motion with the legs. And then of course there's like little styles of massage where you can do for like constipation of the child, that can also be taught. And it's really, I think it's really cool. I always wanted to do infant massage and have like workshops set up where I have, recent, new parents, or, just having a new child, they come and we have, a little baby time, teach them how to massage the baby. Baby's take a nap, have some wine and cheese with the adults, and then have a wonderful day. And it'd just be a nice little way for the parents to have something to do. And I think that'd be kind of fun. But so if you do something like that, so if you have like a little seminar where you have several couples come, or whoever come to bring their baby and learn some infant massage, do consider that, well, babies are usually going to be nude, usually in their just diaper or whatever. So room temperature is a big thing. Lighting, a child's eyes are very sensitive to light, so very keep that light low or ambient. Lubrication. Typically, we don't really use any lubrication just because we don't want that on their skin. We don't want to cause allergies. We don't want, especially like massage lotions and stuff like that. Typically, the massage techniques we're going to do most likely won't really require any lotion anyways. But there are certain types of lotion that you might be able to acquire for a child if necessary. Like I just previously mentioned, the techniques are just going to be like range of motion exercises, just essential play with the child and gentle rubbing. There's certain like gentle strokes that you can do that'll also calm the baby, usually on their back, which is also another selling point of infant massage, is to how you can calm your child and relax your child when they start getting rowdy, grumpy, tired, or just like insomnia, stuff like that. There's lots of little complications that children can have that would, really benefit from understanding, some massage in regards to the child. And then of course, that will just help to develop into their adolescence and how to massage the child, into their, early teenage years, and even, earlier than that. So moving into the elderly population here, we have what's called geriatric massage. And what are some considerations for massaging someone in their later stages of life? Now, of course, we're missing, the in-between between being a baby and here, but that's just normal massage, most likely. But it's not to say like someone who is relatively young couldn't have major complications, such as someone who might be extremely old, as in these conditions, right? So it's always a case-by-case basis. Always gauge the health of the client. But here's some general considerations and concerns when we're dealing with the elderly population. So geriatric massage is a massage modifications that we use for someone who is elderly. Now, typically we consider, well, what to be elderly, somewhere around 65 plus years. We can consider them being elderly and consider them with certain medical complications. Now, again, it's all based off of the factors of health. There could be a 75-year-old person who is as healthy as, who is more healthier than a 40-year-old person, just based off of life stuff, right? But in general, we can consider that someone who is in the later stages of life might be on prescription medications. So do your research and understand what medications they might be. Obviously, there are some effects on the musculoskeletal system. We'll talk about a term called sarcopenia, in which there is muscle loss because of age and the brittleness of the bones themselves. So for instances of conditions like osteoporosis, loss of bone density, stuff like that. So we do need to be cautious and mindful of pressure. The integumentary system, so the skin becomes a little bit more brittle and a little less pliable over time, plus the fat reserves in the skin, the collagen starts to go away. So this is why our elderly clients usually feel a little colder than average. So we might want to have a blanket. We might want to have a non-water-based lubricant, because water-based lubricants can make our clients feel cold. Cardiovascular system, obviously with age, there's just more complications to all of the systems in general, including the respiratory system, urinary and digestive system, all of these. We could also consider that they might have other impairments and disabilities, which we're going to be talking about that here in a few slides. And then consider how you position the client. So typically I'll say that, one, here's a massive pro tip, that if you have an elderly client, and just any client almost in general can benefit from this, always start them face up. Why? Because it's easier to be face up and pull a sheet over you than it is to lay face down and then have to pull a sheet over your back. Even a young, healthy person could have issues with that, let alone someone who might have restricted mobility because of age. Trust me, I know this from experience. I've walked into quite a few people who just couldn't cover themselves and seen some stuff, and then it's obviously they're not doing it on purpose. Hopefully, just have a heart and cover them up. But I definitely learned from experience to start my elderly clients or people that I just feel like might have mobility issues, start them face up so that they can cover themselves a little bit easier before I come back into the room. But other considerations for body positioning would be that laying face down is usually not very comfortable for an elderly client, maybe just general. So perhaps face up and side lying might be your ultimate positions for an elderly client. So taking a look at disabilities and impairments, what exactly is the difference? A disability is typically a term used for someone who has the inability or difficulties carrying out normal life tasks. So for instance, if someone had back pain, they were missing an arm, they were in a wheelchair or something like that, they're disabled. They have, not to say they're incapable, but they have a harder time doing normal everyday tasks than the average person. And then an impairment is where we have some sort of loss of faculty within our bodies. So visual, hearing, stuff like that. And then sometimes, even ambulation could be an impairment as well, but typically those are usually like with our senses and stuff like that. So it's just kind of more of a semantic thing. And honestly, we're just going to consider our people as people, of course, and then consider the situations and circumstances as they approach themselves. But let's go ahead. So here's our term, sarcopenia. As we said, sarcopenia is the loss of muscle mass and muscle density in tissue over the years due to usually inactivity, but other things can play factors in that as well. Mandatory reporting. So what exactly is mandatory reporting? Mandatory reporting is to where you have an obligation to report concerns of an individual's health, well-being, or whatever to the proper authorities. Now, do check with your local governing agency of who exactly is a mandatory reporter and what exactly you're legally allowed to mandatorily report on. So for instance, here in the state of Florida, massage therapists, we are not labeled as mandatory reporters in the sense of we're not able to, for instance, let's say someone they said they wanted to, hurt themselves, kill themselves or something like that. Now, of course, we can definitely have concern about that and make sure that they have the proper or give them the proper resources that might help them. But we don't mandatorily report stuff like that. We don't, because we can't diagnose certain mental conditions like that. But now, of course, every citizen, as far as I'm aware, has a civil duty to mandatorily report abuse, neglect, endangerment of people who are essentially incapable of themselves. So like children or elderly or people who might not be in the proper mental faculty, people typically who have a guardian or someone who speaks on their behalf, those people are what we call vulnerable. And so if they're being abused or anything like that, we have to report that to the authorities. And I guess here's a better example than someone trying to say they want to hurt themselves. But for instance, let's say that someone was in a spousal situation and they were being abused by their spouse. We don't necessarily report that to the authorities. We're not mandatory reporters in that sense. We cannot intervene per se. And there's a bit of a debacle with that. And that one, the reason why is that we're not within that scope of practice to identify these type of situations and stuff and understand how to deal with them. And two, technically, this individual who is being abused is a conscientious adult. They have the capacity to make their own decisions, and so therefore we don't necessarily intervene because it's a conscious choice. I know that I don't like to label it as that, but that's kind of how the law would view it per se. That, theoretically you could just get up and go out, but I know, abuse is way more dynamic than that, of course. But and then especially if you try to intervene without knowing the proper methods of doing so, you could cause more problems, right? So, hopefully this will never happen. But for instance, if you say reported this abuse because you were told, and the cops show up to this person's house to try to inspect it, without proper evidence, the cops can't do anything. All they're going to do is show up to the house, say what's up, say they got a tip, whatever, and then that could set the person off who is the abuser and cause more abuse and even, right, something way worse, right? So, sometimes intervention without proper knowledge of how to intervene can cause more harm than good. Now, of course, you can always, and never tell the client as a massage therapist what they should do. Never give them that type of advice, like, oh, just run away, get out of that situation, because it's never as simple as that. But you can help them say, look, there are places that help, there are resources. Maybe if you find those resources, give them those resources, and always speak up for yourself, right? Just general stuff, because we got to be very careful of how we approach a situation like this. So it's very, very tricky one, and I hope I'm not getting canceled by the way I try to explain that. Definitely don't blame the abuser or anything, stuff like that. But it's a very serious situation, and if this is stuff that kind of concerns you, I highly recommend that you look a little bit more deeper in how to handle these types of situations and what exactly you can do a little bit more than outside this brief explanation that I have for time's sake. So our last slide here is to list the different types of impairments, disabilities, and what we would consider to do for these different types of populations. So, of course, we can have impairments and disabilities in regards to vision, hearing, mobility, cognition, right? All that good stuff. Now, in general, here's a term at the very end of this paragraph here that we want to keep our facilities what's called barrier-free. So especially for those who have visual impairments, those who have mobility disabilities, stuff like that, making sure that there's no obstructions for them to trip on is a big thing. And I'm talking like a tiny little throw rug that is like a quarter an inch thick could trip someone up and make them fall and hurt themselves. So let's go ahead and run through a few general ideas of what to do for each type of impairment. So vision. Well, if someone is, now there definitely is different levels of visual impairment. Some people can just be very hard to see. Some people could have like macular degeneration and see certain things on their peripheral and stuff like that. Or they could just be completely blind and not be able to see anything in all regards, right? And I'll say this, that this is going to apply to every single disability. You can always ask them, what could I do to help you the most, right? And they'll obviously know what they might need help with and tell you how to assist them. But some general considerations is if someone is blind, well, you can stand next to them and say, all right, here's my elbow. If you want to hold on to that, and I can guide you to the room, to the bathroom, to wherever, right? And then you just walk at their pace and allow them to feel out the area, right? Of course, if you walk to the massage room, you can obviously navigate them verbally through the room. Like, okay, so a few steps in front of you is going to be the table on the left, and then, you know, here's the nightstand on the right, here's a chair, just a few more steps in front of you that you can sit on. So, and then if you need, give them a moment to kind of feel out the room, just to kind of understand where things are, because they start to kind of map their surroundings in their head. Hearing issues. So again, wide range. They could just be hard of hearing, or they could be completely deaf. So going with someone who is completely deaf, now, and if you know sign language, perfect, right? But you know, you could always have a pen and pad and paper to write down anything. Now, don't assume that just because someone's deaf, they can read lips. Most likely they can't. So definitely have a pen and paper to, you know, write down and communicate certain things if you need before you do your, while you're doing your intake with that client. And then, you know, one of the other harder things is making sure that communication during the massage is appropriate, right? So usually, like, if I have a hard of hearing person or someone who can't hear at all, you know, one, they usually don't like to actually use their voice and speak, but I'll set up hand gestures. So like 2 taps or 3 taps is pressure or something like that, and then they can do a thumbs up, thumbs down kind of situation. And then, you know, I'll usually do like a tap or 2 or whatever to say we're going to flip over. So you can kind of set certain things up. You know, it's just how you might, you know, perceive, you know, your own little hand gestures. You can kind of set that up. You can even make like a little card. Like if you commonly have, you know, hearing impaired clients, you can make a little card of that, like these setups. And then, so like, let's say someone is hard of hearing, they have a hearing aid. To be very cautious working around their neck and shoulders, because the hearing aid can actually pick up the like low frequencies of the noises that you'll make around it, and it just makes this high pitched whine. It's kind of scary when it happened to me that one time, but yeah, just be very careful there. Now, of course, if they have an interpreter or something like that, speak to the actual client and not the interpreter. You know, because obviously the client is the one getting the service, so speak to them as if they are that person, right? Because they are. Mobility. So in this case, you know, people who have ambulation, so it could just be difficulties walking, could be wheelchair bound, so on and so forth. Again, that first idea is, how can I help you? Do you need assistance, and how can I assist you is the biggest thing. Sometimes you might actually massage them in their wheelchair, and if that's the thing, right? So be it. Sometimes they can get themselves out of the chair. If not, then, you know, maybe it's best that you, and if you have this commonly, to take like some sort of class on movement assistance and how to like get someone out of a chair safely onto a table and vice versa, all that good stuff. But yeah, also consider that the wheelchair is a extension of themselves. So just as you wouldn't just put your hands on a random client or a random person, don't just put your hands on their wheelchair. It's basically them. And then cognition. So we do talk about that when we dealt with the nervous system. We have a pathology for, you know, the various like autisms and stuff like that. But if someone isn't in the right state of mind cognitively, they typically have a caregiver or legal guardian, and we want to make sure that they have their, you know, their permission to work on them, and someone has, you know, basically consented to the massage, so that we want to make sure that they're okay. And then we just approach things slowly. We have to develop a proper relationship with these individuals so that they feel comfortable with us, just as any client, but just we have to be a lot more cautious with that in that case. So that's just a few general ideas of how to work with different disabilities and impairments, and that is the end of our slide. And so hopefully, you know, you guys learned a little something on how to help all of the clients in which you might see. So I'm going to end the video on that one, and I'll see you guys later.